Welcome to the Zoom community chat with Dorie Henning, family nurse practitioner at the Islesboro Health Center. My name is Lauren Bruce, and I'll be moderating the discussion today. A bit of background before we begin. Over the past 3 decades, changes in program practices and the island's population have led to growth in the health and safety services that the town provides, and the space requirements have grown as well. In recent years, staff at the health center, public safety, and the fire department have found their facilities to be too small and or inappropriately designed to accommodate the services that they now must provide. So in May of 2021, after the town considered many other options to provide more space, the select board authorized 2A architects to prepare a schematic design for a new health center building. Today's Zoom meeting is intended to bring more information about this project to the members of the Islesboro community. It's our hope that today's chat with Dorie will give you a better understanding of her duties and the challenges presented by their workplace. Please feel free to write a question for us, and the question option is a Q&A box at the bottom of your page, I believe, and we'll answer questions specific to Dorie and the Health Center first, and then other questions afterwards. So let's begin with Dorie. Thank you.
Hi, thanks, Lauren. And thanks everybody for attending. I just would like to speak briefly about my experience working at the health center. I've been here for approximately 8 years full-time. I was introduced to the island as I had been asked to be the nurse consultant for Boardman Cottage. Started working part-time at the health center, and then took on the full-time position of healthcare provider as a nurse practitioner and the medical director. From the beginning, the first time that I walked into the space, it felt cozy, but also small, with 2 exam rooms, an open kitchen lab area, and a very small file room, and then a small area where Rhonda works to check in and check out patients. Although the area was small, it certainly was adequate. However, in my experience over the past several years, our mission of expanding primary care to the residents of the island, which includes engaging more people in annual physical exams, having them keep up on their preventative care maintenance, mammograms, colonoscopies, immunizations, which ultimately helps reduce hospitalizations, adverse effects of chronic illness, helps reduce ambulance calls. I feel that we've made great gains in that direction. What none of us did count on is to experience a pandemic. And while I don't believe that the pandemic has brought about this issue, this need for increased space and improved design, it has definitely illuminated the pace at which I feel it's important to move forward with a new clinical space. Currently, I would say, just like most systems on an island and most people on an island, we're resilient. We know how to work through issues, and we make do with what we have. And I would say that we've done that extremely well. What we did come up with in the beginning of the pandemic, thanks to having received CARES Act money, which has been extremely helpful. We worked with Janet, and we rented a container that we call the Annex that is in the parking lot. And that has become an irreplaceable space where we do all the phlebotomies, and sometimes up to 20 in a day on Tuesday. And that way, especially during the pandemic, not having 20 people come in and out of the health center it's definitely more time efficient and reduces the chance of exposure for multiple people to possible COVID exposure. And also we use that as a primary testing site. We use that as clerical space for the medical assistant and when we have a nurse to go ahead and do the data entry for the testing. And then the other clinical space that we've adopted is a small trailer out back. And that has been designated as sort of the COVID trailer. So that was a place that we could see patients without bringing a sick patient into the health center and possibly exposing the employees. We've been very careful to make sure that we keep the integrity of the health center and the employees healthy, and have been diligent about acquiring PPE, using PPE, and have worked really closely as a team. So currently, the waiting room, which I think most people are familiar with in healthcare practices, waiting rooms are a thing of the past. We don't have people congregating in a small area with COVID. We have people, our appointments are scheduled and people call in by phone, and then they're met at the door. They're screened for possible symptoms or contact with others, and then they're escorted into the exam room. We have, as I said, 2 exam rooms. We do have exhaust fans that vent to the outside. We have air filtration in the rooms. However, the one room is very small. And if you have a patient and you're in there for any length of time, it's not ideal. So waiting room. So Odessa, who has become our medical assistant and irreplaceable, has taken over the waiting room. That's her office, which there are at times that people, there might be a patient sitting there waiting to be seen or waiting to be checked out. And that just is not ideal for privacy. If Odessa needs to be calling patients or answering the phone. Let's see what else. I was going to talk about, I talked about primary care. The other duties apart from our primary care, urgent care, we often will have people that call up or walk in with lacerations or falls, injuries. As most people know, we provide emergency care, and there is always a provider that goes out on every ambulance call. And if warranted, we'll transport the person to the mainland. If it's a non-severe illness, a basic EMT will go. We also are our primary care providers for all of the board and cottage residents. And in the absence of a full-time school nurse, we've spent a great deal of time, especially over the past couple of years, coordinating with the school. We run the central testing program for the school, and also provide continuous guidance through the pandemic and even before the pandemic, when there hasn't been. I think that last year there was maybe a nurse. Toward the end, there was more full-time, but we spend a lot of time coordinating for the benefit of the community. We also provide guidance and community health throughout the community, to the stores through the pandemic, supplied with the help of many volunteers, Jane Warren, Tom Tudor, Margie Mills. It goes on and on, helping us with testing and vaccinations. So our scope is really extremely broad, and I think that's one of the things that has attracted me. It's very rare to have an opportunity to work in an environment like this and provide this level of service and be able to spend an adequate amount of time with people that often is not possible on the mainland. So I could then go into talking more about the space. Currently, I've received some questions that it may be helpful if I go through. One question that I received was, are there privacy challenges in our current space? And absolutely, that's probably one of the most important issues is privacy. Being on an island, I think people are often reluctant to seek medical care, especially if they feel like their privacy is not protected. And our space just currently is not set up for conversations to be kept private. Right now, as I spoke, the waiting room is turned into Odessa's office, which is right next to where people check in and check out. And so it's really impossible for somebody to have privacy. We do our best, but, patients need to be asked about their insurance information or payment or, follow-up appointments. And that's challenging. The exam rooms are both located in the main hallway, and the conversations, unfortunately, can often be overheard, especially if you have a patient in the exam room that's hard of hearing. And that's, even with the doors closed and the exhaust fan on. Our current lab is located together with the kitchen. We have a piece of red tape that sort of divides the clean and dirty areas. And, we make it work, but it's not ideal. And often we have a blood drawing chair there that often, if the two exam rooms are full, we might give somebody their allergy injections or draw blood or take blood pressure. And it's just not possible to maintain somebody's privacy. We have 2 provider offices, and oftentimes we'll have like a nurse practitioner student. Beth O'Meara is currently a nurse practitioner student. If Dr. Kramer, who's now one of our supervising physicians, who's taken a more active role at the health center, she actually will see patients maybe 4 days per month. And so oftentimes there'll be 2 providers in one office. That makes it difficult if a provider needs to call a patient or the provider needs to dictate a note. It's just not ideal. Let's see. As far as privacy, let's see. I think that's it for privacy. Look over some of the other questions. There's lots of other questions. I don't know, Lauren, if there's more issues to speak to. I think definitely the clinical space we would benefit from at least 2 more exam rooms. It would be really an incredible public community service to be able to have a designated space for dental care, which has gained traction and is a much needed service to the Islanders. Also to have physical therapy under the same roof, being that we're just geographically and sort of academically, clinically isolated, to have any kind of collegial discussions with, ancillary services is always a benefit. If you have a physical therapist there and you have a question, it's really nice to be able to get their advice sort of, in the hallway, just so forth. Also, much needed spaces for counselor. And ideally, if we could have a cardiologist or a pulmonologist specialist come over incrementally, then maybe that would save people having to travel to the mainland as the cost of the ferry tickets has increased.
Was there a question, Dorie, about trauma patients? You have a large sink in one of the examining rooms, and it looks as though is that a concern in terms of having that available when you need it in an emergency and there's a patient in there, or in other words, the setup doesn't seem like it's totally convenient for you practitioners.
Right. So currently, what we call the trauma room, which is one of the 2 existing exam rooms, we do have a stretcher there, and we have our life pack and IV equipment, suturing equipment, and there's an opening. There's a door that goes out to the back driveway behind the town office, and the ambulance can pull in there, so we don't have to take the patient out through narrow hallways. That's very convenient. But we also use that room for sterilizing our equipment. So we have our autoclave there, and we do have a large sink, but it's really not ideal. It would be ideal to have a designated space for dirty equipment. Although, we rinse the equipment, it's sitting there, it's clean, although it's not sterilized. And depending on how busy we are, there can be, a number of surgical instruments that would be better kept separate from a clinical space. Oftentimes we'll use large metal basins to soak people's feet or large wounds, and those need to be cleaned adequately. So it would be wonderful to have like a washer, dryer, stainless steel counter with a large sort of, industrial sized sink to take care of all of that. And
you have a file room that seems like it's wide open. I went through your facility on a tour, and I would imagine that that's not ideal either, that those files are open to the public. Well, they're not open to the public, but they're wide open for possibility of people seeing them.
So we actually expanded the file room thanks to generous donations, probably about 5 years ago, because the space was very small. And it is secured. It's, when there's nobody here, it's locked. But we do use paper files still. And I don't believe that any of the names are visible by any means. But it would be better if they were, I guess, not readily seen, like from the waiting room, for sure.
Great. And you have 2 outbuildings. That's not the correct term, but
yeah,
is that ideal? How would conditions be improved if you had the facility laid out differently so that you didn't have to go outdoors for those purposes?
Of course, it would be lovely to have a designated space for phlebotomy. Right now we're making it work, but it leaves the phlebotomist out there. Although there's a phone, but when you're in a pickle, if somebody should be lightheaded and you needed help, it's really not ideal to be alone with a patient in the parking lot. And again, communication back and forth if there needs a lab test needs to be ordered, and it's not ideal in the cold weather at all. So, and to have an exam room that possibly has negative pressure. So if you did have a patient with a communicable disease, it used to be just tuberculosis that required a negative pressure room. Now, obviously, it's COVID. But if even influenza, to have a designated space that's open, that has a door open to the outside, so maybe the person could come in and leave through, a separate entrance would be ideal. We did have a porta potty out back. That's early in the pandemic. We were seeing a patient out in the trailer, and the person had to use the bathroom, and we couldn't get a commode very fast. The person was very anxious, and so came into the health center. And I remember that was a very traumatic day because we were afraid that that person had COVID. They weren't able to keep their mask on consistently. So, we all went home that night thinking, okay, are we the typhoid Mary? We're going to bring it home to our family. So it's, certainly the situation existed long before COVID, but with COVID, it's just illuminated the need for a better, more usable, safe, patient-friendly clinical space that the island can use, especially as we expand services. As most people know, we did see an increase in our population. We've had more people ask us to be their primary care providers as the cost of ferry tickets has increased, and people just are more hesitant to travel to the mainland, difficulty accessing appointments on the mainland. I think this is a wonderful opportunity for us to look at what we're doing. How do we continue to expand services and bolster the overall health of our community.
Dorie, I did have a question earlier about ventilation. And I know that you all do quite a bit to try to make that all as perfect as possible. But is there an issue of ventilation in terms of the health center?
Yeah, absolutely. The small exam room is really, really challenging. It's small. It does have an exhaust fan, and we had Scott Sinkowitz come and increase the size of that fan. But the air conditioning has never worked well. In the summer, it gets really hot. And if you have a person with like a wound that has a bad odor, or somebody that's sick and coughing, it's a poor space.
Well, you've been wonderful. I don't see any. There's one question about when will we have the opportunity to see the first design for the proposed health center, and that's from Ken Smith. And we're looking at this summer. We should be getting some schematic designs and other for the health center from the architect, but we don't have a firm date at this point. As soon as we do, we're going to put that information out to the public. So I think let me see if there's any more questions. I don't see any other questions. So Dorie, you've just done a brilliant job of laying out what the circumstances are at the health center. Do you want to say anything in closing at this point?
Let's see. Well, I guess I would like to say that Owen and I have spent several hours speaking with the architect that has been contracted, and I felt that she was very receptive, asked excellent questions, took notes, and and the second meeting that we had with her, she obviously listened, incorporated our ideas, asked questions. So I think that was very helpful, and I see that she seems to be a good fit. What else? I guess it's really, we're not quite sure what the next year or two is going to bring for us. And I guess I would say that I'm extremely grateful for your work, the let's see, what do you want to call it? The task, it's not a task force, but the
Health and Safety Building Committee.
Thank you, the committee, yeah. Right, for your work. It's not that it hasn't been on the agenda, for me and the rest of us here, but it just seems like there's always a fire to stomp out. And I'm really glad to see that it's sort of come, from ground roots. And there seems to be, significant interest and motivation. And the select board has been very supportive. So
we did have one more question. Is there a plan to incorporate space for mental health care into a new building? And for
absolutely
both adult and child therapy?
Absolutely. What I would love to see is a discussion about hiring a psychiatric nurse practitioner. That would be an amazing asset. Right now, Joyce Sirota continues to do counseling, but it's by telephone. And to have an on-site a psychiatric nurse practitioner, it's really not feasible, I think, due to cost and really the shortage of a psychiatrist. And psychiatric nurse practitioner has the advantage of prescribing, but also doing cognitive behavioral therapy counseling. So you sort of get the whole package that way. So absolutely, there's such a need, especially in this pandemic. The other thing is we need more support for people struggling with substance abuse, alcohol, addiction and dependence. And yeah, absolutely. Ultimately, to be able to expand our pediatric services, is another goal. And so those are some long-term ideas.
Dorie, we're now getting some more questions.
Okay.
Here's one from Pete. If for some reason the voters do not approve the new clinic, how do you see the level of community care suffer?
Okay, let's see. I see that it is definitely, it takes a toll on the providers and the staff to function under these conditions. Right now, one of the challenges is like keeping the space clean, with the ice and the sand and the mud. I mean, the floors are a mess. It's really hard to keep up on cleaning, and none of us feel good about being in a space that doesn't appear clean. Also, there's just not adequate workspace. I have to send Lisa and Odessa out to the container to, enter data. It just adds another level of stress during a very stressful period. What else? I don't know. It may impact. Linda is retiring in June. It could definitely impact recruiting a new provider if we don't have an adequate office space to offer them. They see the scope of the job and realize, oh, there's 2 exam rooms, and this is what I'm going to be expected to do. Like I said, I mean, we certainly make do, but it's pretty tight. And with COVID, it has been really stressful at times with staff members being worried that they're like too close to other staff members and can't maintain social distance. And there's nowhere. I mean, I'm fortunate. Pretty much, I have my own office, so I can eat lunch in here. But there's like no space. Where are you going to eat lunch? When you have a quick lunch break, you can't take a mask off. So, I guess I hope I answered the question.
Yeah, thank you. That was excellent. Doug Weldon asked, how many square feet do you need? I'm not sure do you know how many square feet you need to expand?
That would really be a better question for the architect.
Yeah.
I know she has sort of the list of what we currently have and what we would like to have. But I think that all really sort of depends on what we decide and budget and so forth. But I would say at least double easily.
And if I understand your space correctly, it's also the way your space is configured. I mean, it was originally a grocery store, a long, narrow building. So it's not really laid out in a way that would take, best advantage of your office needs. And
no, I mean, initially, I thought staying under the same roof would be ideal, because one of the best things about being like close to the town office and public safety is I can just walk next door, especially, in this last year and a half, 2 years. I mean, things continually come up that I need to go talk to Janet about. Her door is always open. I can just walk next door, or Fred, there's somebody to call that might be an ambulance call. There's, a domestic issue arising, I just can walk through. So I felt a little uneasy about being in a separate space, but the more I thought about it, and when I worked on North Haven, we did renovate the clinical space. At the same time, we were seeing patients, and that was just ideal. And I cannot see how that would possibly work here. There needs to be a separate space while construction's going on. That just we're much busier here. That would not work. The other item is safety. If you're on call, there's nobody else in the building, and you're seeing a patient after hours. That's something that we're going to need to consider when we're in a new building as well. So we have panic buttons right now. We've never had to use them. There hasn't been an issue in years. Rhonda did tell me that she had an issue with the patient, being aggressive and hitting her. But it's more comforting to have people on both sides. But we'll take that into consideration if we do build a new building.
Make preparations for it.
Mm-hmm.
I think we're talking about a 2,000 square foot building, something on that order. I don't know for sure, but I don't think it's going to be that much larger a building. It'll be better configured and large enough, more so than than the current space. It'll take care of some additional needs. But
Right.
that question's a good one, and we're hoping that we'll get a lot more information in the next 4 or 5 months and get it out to the public. That's going to be the most important.
I think one of the things also is storage is a real issue. Right now we use the space that we use as a pharmacy for storage. That's not ideal. And we use the apartment upstairs. There's a bedroom, sort of a bedroom up there that we use for storage. The wheelchairs and walkers, that's also upstairs, which it's freezing cold up there. It's dark. It's hard to look for things. So I think in the new space, we talked maybe about having a basement space that could be storage.
We have another question from Doug Weldon. Is any state, federal money available? And I think we are definitely going to be looking into that. I don't know if you know an answer. Do you have an answer to that, Dorie?
I do. We've been very fortunate to have the volunteer services of Adam Thacker, who's moved to the island with his wife, Sierra, who is an RN who has just started working per diem with us. They have 2 children in the school. He's that's his career, is grant writing, and he's an expert in writing and applying for federal grants. So he offered to, as we received the CARES Act grant and the COVID testing grant, that was all great. And then as time proceeded, we realized that the tracking of the money, the reporting is like very labor intensive. So he's volunteered to help us with that. And we also have a vaccine confidence grant that he's helping with the reporting. So he has done a very thorough search, and he said that right now there is not currently money for this type of building fund. There was, but we sort of missed. It was a 2021, I think, with Biden and COVID money, but there's not currently. I think they're focusing more on like Native American health centers, but he's continuing to look. So as of right now, there is not anything available, but he has done a thorough search.
Great. I don't see any other questions. Let me just check one more time. And I think probably, unless you can see, were there any other questions that were sent to you, Dorie, that glancing down, if you have anything else in there that you want to address?
Let me look.
I think you've covered a lot of territory.
No, I think that's about it.
Great.
Yeah.
Well, thank you so much. Oh my goodness, 8 years.
Yeah.
We've been so lucky to have you. I hope that at some point we can get a video of your space. Many people who saw the tour were quite amazed at how creative you all have been in making use of that space, best use of that space. In every single nook and cranny, you have something. So, and again, thank you so much. I appreciate it. We all appreciate it. And again, thanks to all the listeners out there, and to our master of technology, Michael Hutcherson. So thank you all, and have a great day.
Okay. Thanks, Lauren. Okay. Bye-bye.